just like we talked about with each type of blood component, let's talk about disorders. So disorders related to bleeding and clotting. So the first one is, these are going to be bleeding disorders. The first one is called thrombocytopenia. That means you do not have enough platelets. If you don't have enough platelets, you can't form a platelet plug. So that means the damage that's caused, that's normally repaired that you don't know about, is also present. So you may see this in people. They'll have these patches on their skin, kind of like on their arms, and it's called petechia. And it looks, like bruises, but it doesn't necessarily hurt. You can also have bleeding disorders by having as a result of an impaired liver, because the liver makes clotting factors. Those 13 of them, not all 13. Now, the clotting factors require vitamin K. Where do we get vitamin K? Vitamin K generally comes from leafy green vegetables. Think spinach, kale, kind of stuff there. So leafy green vegetables. And as a result from bacteria in the large intestine. Now, but in order to absorb vitamin K, you have to have bile. So bile is required in order to get vitamin K into the body to actually be useful. You can eat it, but it's not going to be useful if you can't get it into your blood vessels, because vitamin K is fat soluble. So it needs some help to get through. It's not gonna just float through the blood. And bile is made by the liver. So if you don't have a good liver, you can't absorb the vitamin K. And if you have an impaired liver, you also can't make the clotting factors as well. So this is a big deal, particularly with cirrhosis. Can be caused by several things, most notably alcoholism. So long-term alcoholism. Other disorders of bleeding, hemophilia A. This is where there's a deficiency in factor 8. Now, factor 8 is part of the intrinsic clotting pathway. This is the most common. 83% of patients with hemophilia have deficient factor 8. Hemophilia B is deficient factor 9. So that's only 17%. So that's not nearly as common. Now, both of these deficiencies are sex linked. So what that means is, so they occur mostly in males. Because if we have a genetic female, here, let's say here's her 2 chromosomes. She has an X chromosome and an X chromosome. We talked about this in A&P1 lab, not hemophilia, but these sex-linked traits. So females have 2 X chromosomes. Well, if we have 1 for hemophilia, and then she has another normal one, then she's normal. She's what would be considered a carrier. So females can carry, but you don't necessarily have to have 2 copies. You just can't. Females can override it. Now, in a genetic male, males are XY. So this is, hemophilia is only on the X chromosome. So if a male has this on the X chromosome, there's nothing to override it because Y can't override it. It's different than X. So hemophilia occurs most common in males. If you read into history, you will find that hemophilia was very common among the European monarchs because of all this like intermarriage that went on. Because royals can only marry royals, and it resulted in somewhere along the line, somebody was a carrier of hemophilia. And so it was difficult. Now let's talk about the opposite of bleeding disorders. These are what happens when we have clots where we don't want clots. This is called thromboembolism. So we have a blood clot where we don't need it or don't want it. All right, so you can have a thrombus. This is a clot that's formed in an unbroken blood vessel, so it doesn't need to be there. If it gets big enough, you can just block the blood flow on its own. However, what can occur is an embolus. Here we have our thrombus blood clot. These generally happen in the legs. Venous thromboembolism usually happen in the legs. So part of our thrombus breaks loose and it starts floating. Now it's in the bloodstream. Well, it's a solid thing and eventually it's going to get to where it can't get through something. So where this happens, we call it different things. If it gets stuck in the heart, we call that a heart attack. If it gets stuck in the brain, we call it a stroke. If it gets stuck in the lungs, we call it a pulmonary embolism or a PE. So we do have drugs that we can get to prevent this from happening, or we can use it to treat it. So the first one is heparin. Remember, heparin occurs naturally, but we can make it and give it to someone. You know, we can inject it and help prevent or break up a clot that way. You can give aspirin. Your patients can take aspirin. This inhibits thromboxane A2, which you may need to flip back a couple of pages, which is released by platelets. So aspirin inhibits platelets. So you may know people who take a baby aspirin, that 81 milligrams there. Or you can give warfarin. That's an F, warfarin, also known as Coumadin, brand name. This interferes with vitamin K. It's an anti-vitamin K. And so when you don't have vitamin K, that means the liver can't make as many clotting factors. There's some other newer drugs that are used out there now as well, but we're not going to get into those. These are the old, hard, tried and true ones.